Integration of telephone triage nursing with integrated healthcare systems, or IHS. This is a presentation for Thomas Edison State University NUR 8320 Organizational and System Leadership course, Professor Dr. Marcy Tanner Garrett, and this is by me, Tennessee Kelly. The agenda is to look at my leadership style, look at the reasons for the project, review the strategic initiative, talk about the purpose and aims of the project, review the synthesis of evidence, look at the model of change theory I have selected, look at the outcomes, both short-term and long-term, the PICO, the SWOT, the fishbone diagram, the driver diagram, the Gantt chart, evaluation of the project, and conclusions. So my leadership style. I believe the purpose of a leader is to help people and organizations adapt in the face of challenges. I believe everyone in the organization is equally important, and we need to share the same sense of purpose in order to be successful. So I have an adaptive, caring leadership style. This means that I value emotional intelligence. Adaptive leaders are sensitive to the feelings of others, foster empathy and understanding. Also, I believe in an organizational justice, that the principles I emphasize fairness in treating everyone equally within the organization. I believe in development. Adaptive leaders embrace new strategies and processes to help the organization succeed and prepare for change. And character. I believe that a leader has to earn respect from her peers. It's not just given simply because you're put into a position. Reason for the project. So reduce delays of care, streamline communication between provider, patients, and communities, enhance efficiency in patient communications, integrate data and services, meaning telehealth technology with patient care and outpatient services, improve continuity between provider to patient to services to home care, that kind of thing, and cost savings. Obviously, you're going to save money. There's going to be costs that are saved when these things are streamlined and the patient doesn't have to go to the emergency room for something that could have been handled Monday morning. So integrated healthcare systems, or IHS, and telephone triage nursing, I believe play a crucial role in creating a seamless network of care. Okay, so the strategic initiative for this project. So by integrating telephone triage nursing into a healthcare system, we can reduce delays in care. So that means that triage nurses ensure timely access to care by talking to the patients remotely and directing them to appropriate services. IHS, or healthcare system, streamlines communication and coordination among healthcare providers. This minimizes delay in care. So this results in that enhanced efficiency. Enhanced efficiency, telephone triage reduces unnecessary ER visits and can schedule office appointments instead, and just optimizes resource utilization. So this integrates data, services, improving efficiency and reducing administration. So there's that improved continuity, so reducing ER visits and things like that, and of course cost savings. So when we look at the goal statement for part of the strategic initiative, the goal is to achieve the triple aim. So the triple aim is improve quality and experience of care, enhance population health, and reduce per capita costs. So how do we measure this? So the core measurements essential for program integrity and patient safety. So there's the CMMI, or the big three measures, primary outcome measures for healthcare utilization, the big four measures, so mandatory for 911 nurses, which is kind of what telephone triage nursing does. We do connect patients with 911 services, and also integrating all of those providers and services together. So the measures of that, of course, in the end will be patient satisfaction and cost. So the program design measurements, we're going to look at executive sponsorship, the strategic plan, which we're talking about now, community resource capacity assessment. What are the resources in the community that the triagers can access and still maintain HIPAA and legalities? So then we got to have the medical oversight, health information technology, or HIT. There's the public and stakeholder engagement, which needs to happen. And of course, these nurses will have to have specialized training, IT integration, and that kind of thing. So there needs to be like a compliance plan to incorporate that integration. So the integration will be the healthcare, the social services, the public safety as far as EMS goes, Sometimes it's fire safety, pest control. There's all kinds of resources, elderly care, abuse, suicide hotlines, and things like that that the triage nurse can access. Instead of just saying, here's this number, call it, you can do a warm transfer with the patient so that all those things are integrated in the care, and it just makes for more, especially with elderly patients or people who have mental health disabilities. By enabling that triage nurse to integrate the healthcare system, that nurse is going to be able to really care for her patients holistically. Okay, so the purpose and aim is the overall aim of integrating telephone triage nurses into that healthcare system, and that's to improve patient outcomes, healthcare utilization, and obviously reduce costs. Okay, synthesis of evidence. So we're going to look at two articles for evidence-based practice. One was written by Getch and Luch. It's an excellent article called The Step-by-Step Guide for Primary Care Providers and Behavioral Health Clinicians. So this talks about the umbrella of care, interprofessional practices, term-based care or team-based care, and shared responsibilities. So Getch and Luch talk about this step-by-step thing. They discuss the elements needed for the integration of the healthcare system, otherwise known as IPP. They define IPP as a collaborative practice that occurs when healthcare providers work with others from their profession. So this is within providers, but also within community resources. And in the panel, they talk about how there's this umbrella, they call it, of care, which is kind of like the umbrella under the healthcare system, which includes the provider, the hospitals, the clinicians, the outpatient resources. So they really get into a lot of things that help to sustain and validate this need through their evidence-based practice research that yes, these things do help. Yes, there is increased patient satisfaction, and yes, the providers are even more satisfied with this umbrella of care. So the next article we're looking at is the Lake. Lake has actually written lots of articles as far as telephone triage nursing goes. So I actually have a couple different articles I'm sort of combining for this, but the one that was really applicable was the quality, safety, and governance of telephone triage advice services, an overview of evidence from systematic reviews. So this is looking at how all providers, cardiologists, hospitals, EMS, all these people come together and go, yes, these triage nurses are kind of the hub of all these different systems, and so integrating these things is, of course, just common sense, really. It just sort of needs to happen, and what a great resource to be able to allow the triage nurses to connect the patients with the providers and with the care. So she actually takes 10 systematic reviews and looks at 291 results from different tests to show this model of integration and how it's applicable and comprehensive and beneficial. She says how there's telemonitoring. Telephone triage nurses look at EKGs, blood pressures, glucose monitoring. You know, we can see what your blood sugar is right now. We'll call you if it's not right and tell you what to do and where to go. There's this collaboration of care, the endocrinologist to the triage nurse, to the ER, to the hospital, to the patient. So and then access for services in rural areas. Many of our patients are in Inuit communities in Alaska who closest hospital is 20 hours away, and they can only get to it by plane. So there's different protocols to be able to care for those patients that a nurse normally wouldn't be able to say or do or advise, and these protocols help to connect these people with different services. So we're able to reach out if there's a suicide or suicidal thoughts to the police and tell them our own report, or tell the provider, call different family members, say, hey, I think you need to go check on so-and-so. Also, there's health aides and things like that. So those rural areas and those really remote areas are so benefit from these telehealth services. Okay, so the change model that we're going to apply is Kotter's 8-step change model. It's just very lucid and organized, and I love the way that it creates a sense of urgency and just helps the researcher put into focus what needs to be done to make this project happen, right? So first, create a sense of urgency. Second, build a guiding coalition, form a vision, enlist an army. enable action by removing barriers, collaborate short-term wins, sustain acceleration, so making sure that the acceleration is still happening and people aren't losing focus. We're redirecting, we're adapting, and anchor changes to systems. So I'm just going to highlight a few things. I'm not going to go through every single step, but applying this to this, the highlights, the benefits of improving patient access, long-term cost savings, and increased revenue. Key players, that would include triage nurses, IT staff, administrators to support the change, to ensure the leadership buy-in and commitment. So the leaders need to buy in and commit to this change so that it'll happen. And then implementing little small changes and celebrating every little victory is part of Kotler's 8-stage model that really helps to just build that guiding thing. So who's involved, this team of stakeholders, telehealth, triage nurses, and stuff like that. What's the vision? What's our clear vision for the future? We have this vision of this umbrella of care for these patients. The Army, again, staff and that kind of thing. And community resources would also be involved in that. Keep going. So we need to maintain the momentum and anchor that change in and continuously improve, adapt, and change. So by looking at those 8-stage models, we can really see how this project plan could come to fruition. Okay, so outcomes. So what are the outcomes we're looking for? Enhanced patient satisfaction, integration of patient referrals, optimized resource utilization, allocates healthcare resources, holistic patient care, as we discussed, reducing unnecessary ER visits with costly healthcare utilization, and coordinating between providers, specialists, community resources. So the patient calls a telephone triage nurse and she says, the fever's only 100. You don't have to go to the emergency room. Let's talk through what we can do about it, right? Okay, so the PICO. So the PICO is in patients utilizing telephone triage services with the integrated healthcare systems, IHS, with telemedicine, improved patient satisfaction over a 6-month period. So the population are the patients calling in. Intervention is adding this systematic IHS program. Comparison, we're going to compare both, so those pre and post patient satisfaction surveys. Outcome, hopefully improve patient satisfaction as predicted, and time, this will be over 6 months. So patient outcomes we're looking for is telephone triage can positively impact patient outcomes, ensure timely and appropriate care, and refer them to ER when necessary. Measurement tools, pre and post surveys, enhanced resource utilization. So effective telephone triage allows healthcare providers to allocate those resources more efficiently, and cost reduction. So obviously if the patients aren't going to the emergency room or even to the urgent care, or they're not buying these medications we're going to tell them not to use anyway, they're going to save money. Just because it looks good in the drugstore doesn't mean you should take it, right? So the SWOT. So the SWOT is the strength, the weaknesses, opportunities, and threats. So obviously the strengths are this accessibility of telehealth, cost efficiency, scalability, patient compliance. Weaknesses, well, there's barriers. So some patients lack the technology. They don't have a cell phone, or maybe they don't even have a phone. They can be scared to talk about themselves over the phone, right? There's this fear of giving your information out over the phone. Lack of physical examination is a barrier for triage nurses. We can't see you, so you can get to the end of a triage and tell the mom to follow up Monday, and then she goes, well, should I just put the Tylenol through the G-tube? So there's definitely things that can be missed. So thorough training, triage nurse education, those kind of things definitely need to be applied. Threats, so regulations, HIPAA, resistance to change. A lot of these triage nurses, or I don't want to say that, I would say that some people don't want to add more to their list of to-dos. So if you have to do all these referrals, you're not getting off that call quickly. You're going to have to really dig in and do all these other things. And some of the nurses who've been doing it a while, maybe they're not going to want to do that, right? Maybe they're just used to their routine. And they know what they do, and they do it well. So just the training, the confidence, and the reassurance thing is important. And then, of course, the gap analysis. And this is identifying the gaps and where do we have to focus. So once you do the pilot, you can see like, okay, actually it wasn't what we thought it was going to be. There was going to be a problem. It's actually this other thing, you know. So the best way to go about looking at things would be the pilot study. So we're looking at our fishbone diagram. So I won't read every single thing for you, but as far as manpower goes, we've got administrators, nurses, clients, which are providers in hospitals and such. Methods we're going to use. So this is the triage protocols, the workflow charting, scheduling, legal considerations, ethical compliance, technology integration. Resources, again, technology, remote monitoring, EHRs, so the medical record is going to be very important. Security, so security of these charts and these conversations, because all the conversations are recorded. Measures, so we're going to look, of course, tip tops, patient satisfaction, clinical outcomes, cost savings, data collection, feedback loop. We're going to look at the feedback loop and say, hey, are these things working effectively? Stakeholder engagement, are they engaged? Are they receptive? Are they enjoying? Are they liking what's happening? And then the community needs. What are the needs of the community and how can they be addressed? So the overall goal of the fishbone diagram is, of course, increased patient satisfaction. So we have our driver diagram. So this looks at our aim, but then also takes into what is the driving this initiative. So that's sort of increase patient satisfaction, but also in a deeper level, responsibilities, integration, healthcare system integration. The secondary drivers are that medical oversight, the IHT, developing the protocols, right? We're going to have to develop those protocols and enhance those resource connections. So the change ideas to test, we have to look at the integration, we have to look at the technology, and then we got to monitor the patient outcomes. Okay, then we have our Gantt chart, and this is just an overview of how long this is going to take. So obviously the first initiative is for week 1, and that's going to include the plan of the project and such. 2 and 3 is the needs assessment, and then the 4th week will be the technology evaluation. How can the technology sustain what we're doing? Workflow design is then again 6th and 7th week. 8th week, we're looking at the change management plan and address any problems, training, education, so those are at 8 and 9, and pilot testing, which is super exciting, week 10 and 11. So that's when we're going to do our pilot and see how these nurses have been trained and see if they're going to be able to do these things and see if the patients like it, what are the glitches, what do we need to correct as far as technology goes, and that kind of streams from 12 all the way to 16 and forever and ever. You have to keep continuing evaluating, continuing adapting, continuing to look at how can we improve the flow of the IT, of the calls, of the resource allocation, and then of course patient satisfaction and client satisfaction. How are these things going? So outcomes: improved access to care, enhanced patient engagement, cost savings, efficient resource utilization, increased provider efficacy. So obviously the providers can be more effective if the triage nurse is handling the referrals and the coordination of care and giving the home care referrals and checking up on the home care, checking up on the vitals and those kind of things. Better continuity of care, again, kind of applicable, and health equity. So health equality, so basically these patients in remote locations will get the same care and treatment that in rural areas that people in the big cities can get. Conclusion. So final thoughts. So integrating a healthcare system program into telephone triage would offer more holistic products for the clients, better care for the patient. So integration allows healthcare systems to analyze trends, identify gaps, and further refine protocols. And this patient-centered approach to care is ideal and focuses on the patient's safety and satisfaction and encourages the continuity of care. These are my references, and then just a big thank you.